Okay, before we start, I'll remind attendees to make sure that you have your microphone on mute for the duration of the presentation. There will be time after the presentation to ask questions. Good afternoon and welcome. My name is Lori Ritz, and I'll be providing an introduction for the presentation today. I'm an associate professor in the School of Nursing at Laurentian University, but I'm also a member of CASN's Research and Scholarship Committee. I'm happy to welcome all of you to this Lunch and Learn presented by our CASN Research and Scholarship Committee. The presentations in this series focus on the implications for nursing research and education associated with the use of machine learning, artificial intelligence, and large data sets. I'd like to start this session with a land acknowledgement. CASN's national office is located on the traditional territory of the Algonquin people, and we'd like to acknowledge and pay respect to the Algonquin people. We acknowledge their long-standing relationship with this territory. We pay respect to the Indigenous people in this region and all regions across Canada. We acknowledge the traditional knowledge keepers and honor their courageous leaders. Lunch and Learns are a popular tool in academia to encourage scholarship where faculty members come together during their lunch hour to share their work and to network. CASN's webinar series, presented by the Research and Scholarship Committee, aims to recreate the collegial feel of the Lunch and Learn and is intended to serve as an inspiration and a networking opportunity. Here, nursing faculty from across the country present their scholarship projects and discuss methodologies, successes, or challenges that they've encountered in their own work. We will be recording today's session. Our presenter will have 40 to 45 minutes to discuss her work, and then the session will conclude with a 15 to 20-minute presentation and answer period. To submit a question, you can do so using the chat function or by raising your hand at the end of the presentation. Please note that CASN does not distribute the PowerPoint presentations. In this session, we'll hear from Dr. Charlene Chu from the University of Toronto, whose presentation is entitled Scoping Review to Inform the Nursing Informatics Entry to Practice Competencies for Registered Nurses Update. Dr. Chu, thank you, and we greatly look forward to your presentation.
Hi, everyone. Thank you so much for attending. So first of all, a very big thank you to Don Fleming and the rest of the CASN Research and Scholarship Committee. And of course, thanks so much, Laurie, for facilitating today and the land acknowledgement. Thank you very much. So it is an honor for me to present here at the CASN Lunch and Learn and to be part of this series focused on machine learning. If attendees have not watched the previous videos of the previous speakers as part of this panel, they are posted on YouTube, and I highly recommend them. They are excellent. They include speakers including Doctors Tracy Riesling, Jae-Young Kwon, Charlene Ronquillo, and others. And so, of course, I'm very humbled to be in their company and to be invited in this extraordinary group of scholars. So thank you again. So my name is Charlene Chu. I am an assistant professor at the Lawrence S. Bloomberg Faculty of Nursing at the University of Toronto. And my research program is focused on technology-enabled interventions to improve the care of older adults. And so inherent in my work is building capacity in frontline nurses in not only how to use digital health technologies responsibly and safely, but also to make sure that nursing knowledge can be embedded into the design, implementation, and evaluation of various technologies as well. So this is an area that I am incredibly passionate about. And so for today's presentation, I'll be focusing on the scoping review to inform the nursing informatics entry to practice competencies for registered nurses. And this is the update for CASN's ETPs. So I want to first thank and acknowledge my research team that mostly consists of Masters of Nursing students. So they're all listed here on the screen. They come from a variety of clinical backgrounds. I also have a medical student on the team as well, and a PhD nursing student. I'd also like to acknowledge my co-PI, Sarah Abraham, and co-applicant Charlene Ronquillo. So this work is funded by the University of Toronto's Provost Instructional.
So Charlene, I hate to interrupt, but we don't see your screen.
Oh.
Sorry, I didn't.
Thank you, thank you.
Yeah.
Oh, let's see. 1 second. Thank you, Don.
No. There we go. There we go.
Do you see my team?
Yes, we
Yes,
do.
thank you.
Perfect. Thank you. Thank you. Thank you. Okay. This was my slide. This was my title that we put together. Okay. So my team. So this work is funded by U of T's Provost Instructional Technology Information Fund, Bloomberg Nursing's Rosenstadt Research and Development Fund, and U of T's Work Study Program. So thanks to the funders as well. Okay, so to highlight the importance and need for updated nursing informatics competencies in nursing, in undergraduate nursing curricula. So I'll start off focusing on highlighting this need. Then I will jump into describing a scoping review that we have conducted and the methodologies of that scoping review. And then lastly, I will provide the findings to inform the nursing informatics ETPs in nursing informatics ETPs competencies for registered nurses. Okay. So health information technologies and artificial intelligence have modernized our healthcare system and have impacted the ways in which clinicians practice. As a result of this rapid advancement in digital health, nurses are required to be knowledgeable in informatics. And nurses, all of our graduates are using technologies all the time. For example, they use technology to monitor patient care, monitor patient recovery. All assessments and treatments are all documented electronically. Nurses are interacting with AI algorithms and clinical decision support systems that are also used to help predict patient complications in real time, like sepsis, falls risk, and these supplement their clinical nursing judgment. In other forms of clinical skills, for example, providing psychosocial support for families and patients. Our patient and family education is also being provided through technologies as well. And today's patients are also very technologically savvy for the most part, and they are getting the majority of their health information online and through these devices too. So nurses need to be aware of how to advise on credible information for the betterment of their patient. Nurses also use technologies to communicate with team members, providing patient level updates as well as unit level updates too. So this information can also inform and evaluate different programs and services. Lastly, the two pictures on the bottom right on your screen here, this is in relation to virtual care, remote care, e-health, mobile health, and these technologies allow nurses to increase our reach to different places and spaces. And so, for example, nurses are able to help not only patients in different parts of the world, but also clinicians as well. So, however, technologies can also be a source of intervention-generated inequalities. So this is according to Vanneau in 2018. And digital inequality is a significant concern. This is a map of, so this is a map of internet access and internet use globally. And so in this picture, you'll see bright whites and dots of red, and these lie and are mostly distributed in high income countries, while other highly populated parts of the world are in near complete darkness. And so the lower middle income countries are also indicated here in blue, indicating that there are many, many people here, but no IP addresses for them to use. So these low and middle income countries are some of the most densely populated places in the world. And these regions of the world are also the most likely to be impacted negatively by the environmental consequences of building the technologies that the global north uses, as well as the compute power to allow us to use AI in the ways that we do. We also have the issue of bias in AI. So I do a lot of research in this area, and bias in AI can be caused and result from a variety of different sources. But we can start here from, very briefly, we can start here from the data that's in the yellow quadrant here, where we have data that is discriminatory data, and then the data is then embedded into the development of different algorithms and technologies. And so that's in the blue quadrant. This bias technology is then deployed into society in general. So that's in the pink quadrant. And then the consequences of this technology leads to the amplification of different inequalities and discrimination. And so that's in the purple. And so often these technologies impact our social determinants of health, because access now to social determinants of health are also mediated by technologies as well. And so then the data from this discrimination from the purple quadrant is then captured in the data, and then it's then captured in the data that is then reused in the yellow quadrant. So the cycle continues on and on. And so with this backdrop, nursing informatics is more relevant than ever. Nursing informatics is defined as the practice and science that integrates nursing information and knowledge with technology to promote the health of people, families, and communities. The joint position statement by the CNA and CINIA emphasizes that nursing informatic competencies are essential for nurses in all roles, and that as technologies evolve, nurses will also need to adapt in response. And this is incredibly important and salient, especially given the emerging technologies in today's world. So appreciating the rapid advancement of technologies in healthcare, CASN recognizes the imperative to update the current nursing informatics entry to practice competencies for registered nurses. This timely update to the CASN ETP competencies based on the synthesis of current literature will help ensure that graduates from our nursing programs across Canada will be better prepared to confront the global challenges that are facing our society, including in health. So the study aims of the scoping review are threefold. The first was to synthesize the current educational state of nursing informatic competencies within undergraduate and graduate nursing curricula and their programs. The second was to identify nursing informatic competencies to inform revisions to the ETP competencies. And then the third is to develop best practices to embed nursing informatics into nursing curricula based on the review findings and revised ETP competencies. So this presentation will be focused on the undergraduate portion of our findings. So the Arksey-O'Malley framework for scoping reviews was used for this work, and it's comprised of 6 different steps. So first, we solidified our inclusion and exclusion criteria. We used literature from both academic and grey sources, and these sources needed to focus on practicing nurses or nursing students at any level. Literature needed to discuss nursing competencies or how nursing competencies were integrated into curricula. Articles needed to be published in the last 10 years or more recently. Our team excluded articles that were not published in English. We also excluded articles that were focused on health informatics broadly or specific technology interventions that were implemented, again, without any kind of focus on nursing informatics. And then we also excluded dissertations, book chapters, and conference abstracts, but we did include conference papers. So then we used the search strategy that we developed with the librarian at the University of Toronto. The key terms are listed here on the slide. And then we conducted this search in 7 different databases, and the databases are listed on the slide as well. And then we took the results and uploaded them into Covidence software, which we use to screen and extract the data in accordance to the JBI manual for the scoping reviews. All of the screening was done by 2 independent reviewers at each of the different steps. And it's important for me to note here that we actually did this search twice. The search was completed the first time in September 2022. And so to make sure that the CASN competencies were updated using the most recent data, we actually repeated the search again just this past December. So here's the Prisma flow diagram. And our results generated, the results from our search generated 8,600 hits. After screening through the various stages, we had full text screening of over 1,100 papers. And at the end of the day, we included 248 articles for the review. 186 of them were focused on the undergraduate program, whereas 80 of them were focused on graduate nursing, graduate nurses. And so for the remainder of the results, I'll be focusing on the undergraduate. So with respect to the study designs of the papers that we're looking at nursing informatic competencies at the undergraduate level, we can see here in this pie chart that there's a diversity of article types, and this suggests this multi-dimensional approach to studying nursing informatics. And most importantly, we have a lot of work that is focused on a qualitative, using qualitative methodologies, which indicates a significant focus on trying to understand the subjective experiences, perceptions, and perspectives of nurses in the field. We have some text and opinion articles. So these were commentary papers, for example, literature reviews, as well as Delphi studies. We had 8 Delphi studies, which indicates a focus on an attempt to build consensus of expert opinions in the field. With respect to the years of publication, there's an overall increase in the trend of the publication with a peak in 2017, and then it's followed by some fluctuations over the years, but the threshold overall has been increasing. So we do see this increase in interest as well. With respect to the countries of origin of the studies, the articles included spanned 6 of the continents, North America leading the pack here with 82 of the results. 47 of them were from our friends down south, but it's important to highlight that 35 of them were published in Canada by Canadian scholars. So this really indicates a very strong contribution from scholars in Canada when it comes to nursing informatics. And there were also several studies that had multiple collaborations across multiple countries. So Canada, Australia, Europe, Brazil, Taiwan, China, etc. And then when we looked at the cited nursing informatic frameworks that were used in this literature, the most frequently mentioned frameworks and organizations were the TIGER framework here, which is the Technology Informatics Guiding Education Reform. So this is a widely recognized initiative in the nursing informatics community that's aimed at promoting the integration of information technology into practice, education, and research. And second, we have the CASN ETPs. And so again, very strong Canadian presence on a global scale in terms of nursing informatics. And then this is followed by CASN, which is the Quality and Safety Education for Nurses. And after that is the American Association of Colleges of Nursing. And then lastly, we have the International Medical Informatics Association. So I'll now start to describe some of our findings in relation to the nursing informatic competencies. And so all of this work was done in conjunction with the CASN Digital Health Competencies Advisory Committee. So this is a group that was co-chaired by Dr. Eric Millay from the University of Sherbrooke, as well as Nadia Green. I think there are also some members of, I'm sorry, I can't see everyone's tiles, but I think there's also some members of the advisory committee that are on the call as well. But the overall purpose of the group was to integrate some of these expert opinions to inform and update the nursing informatic competencies. And the group consisted of key leaders of nursing informatics across Canada, as well as in leaders with respect to research, education, and professional practice. And so there were regular meetings where we really interrogated the findings in order to apply them into the CASN update. And so I want to acknowledge all of that hard work. And just as a reminder, the current CASN informatics document has defined 3 entry to practice domains. So they are highlighted here in green on the slide. They're information and knowledge management, professional and regulatory accountability, and information and communication technologies. For each of these domains, there's a central competency. And then for each of these competencies, there's a list of indicators. And in our analysis of our results from the scoping review, we mapped all of the competencies that we found in the literature into these larger domains. We also mapped them into the Tiger framework as well as part of our analysis. And so these domains will remain in the CASN update, and our findings serve to really support, to update the indicators within each of these competencies. So I will discuss some of those recommendations in the next slides. Okay, so for our first domain, we have information management. So there used to be 7 indicators in this domain, and through the literature and working collaboratively with the CASN working group, we developed 9 new indicators under this domain for a total of 16 competency indicators. So an example of one of these competency indicators seeks for undergraduate nursing students to assess patients and their family, assist patients and their families to access, review, and evaluate information they retrieve using information and communication technologies to manage their health so that the information is current, credible, and relevant. And then we had several overarching themes also within this domain that centered on nurses having the basic ability to review data, to be able to review and understand evidence and information, patient-centered care, and the use of information technologies or health information technologies. So, for example, this is supporting patients and being able to access their own records and supporting patient portals, for example. Next, we have an appreciation for the unique role of nurses in digital health and health information technology development and use. And then lastly, we also have an understanding of systemic influences on health technology. So an example of this would be that the nurse is informed and respectful of cultural values and beliefs of the patient / family / communities when integrating health information technology. In the second domain, looking at professional and regulatory accountability, this domain originally had 5 indicators, and then based on the literature and again working collaboratively with the working group, we added 6 new indicators here for a total of 11 competency indicators. So an example of one of the new indicators is considers principles of social justice, health equity, and social determinants of health when utilizing health technologies. So e.g. recognizing disparities in access among diverse patient populations. So other overarching themes that were within this domain were around the socioeconomic context and health equity, biases within AI, so that nurses will be able to consider biases in the development of digital technologies and the use of AI in healthcare, and professional social media content. So for example, that nurses are complying within the legal and regulatory requirements. And then in the final domain of information and communication technologies, we initially had 5 indicators here, and we added 6 new indicators totaling 11 competency indicators. So an example of one of the indicators is that the registered nurse will be able to collect and analyze electronic patient data and information to enhance clinical decision-making and nursing practice. Other themes that we found within, again, this domain focused on the use of AI and decision support tools, interprofessional collaboration. So for example, that the registered nurse will be able to effectively communicate and liaise with patients and other healthcare professionals within digital environments, documentation, accuracy of documentation, and then also remote care. We also looked at trying to develop some best practices pertaining to what are the ways that we saw in the literature how nursing informatics were taught, and how effective were they, what were the methodologies that were used. So when it came to the nursing curricula, we were able to establish some of these themes, but we are still in progress of analyzing this data. And so we're still trying to get to some of these granular details, and hopefully we'll get to them, I'm hoping by the end of the season. But I can share with you a few of our kind of larger umbrellas that we've found thus far. So first is that we saw that there were very few publications that mentioned or favored a distinct standalone nursing informatics course. It was widely recommended across the literature to try to adopt digital health and really embed it throughout nursing education across different courses. That's what we found. The second is that, it's related to the first in that in this regard, many nursing programs reported this very heavy reliance on either one or two nursing informatic experts, and that the recommendation is that all nursing faculty should be competent in nursing informatics. And this suggests that there should be a greater focus on providing nurse educators with opportunities for professional development, and that these opportunities should be equitable and they should be accessible to faculty. The fourth point here, in order to identify existing gaps, ongoing needs assessment of nursing informatic competencies for both students and faculty is recommended as well. And this is a trend that we saw in the literature too. And so this, I think, becomes more necessary as technology continues to advance over time. So as technology continues to advance, the needs of our students and our faculty will also advance as well and change over time. Next, some of the literature also mentioned the importance of interdisciplinary collaboration for curricula development, and this highlighted collaborating with informatics specialists. And lastly, the literature indicated that nursing schools should, if they can't develop a curricula themselves, at least engage in curricula that allows for specialized nursing informatics training. And then through our preliminary analysis, it also became clear that we uncovered this need for this blend for both theoretical and experiential pedagogy. And so theory can be delivered through course lectures and should encompass teaching on the importance of informatics, why nurses should be involved in technological decision-making, how digital health relates to nursing practice in general, and how it relates to patient outcomes. We need hands-on approaches, for example, in simulation labs, in order to use some of these electronic medical records and other devices. And this will help enable students to practice and also critique technologies in some of these controlled settings. We need clinical placements where students can actively participate in the development and implementation of some of these clinical systems. And this, again, will help enable the practical use of nursing informatics. And then our last point is around partnerships. So schools of nursing will need to develop strong partnerships with clinical settings to enable the use of digital health tools during practicum to increase nursing informatic teaching opportunities. So with respect to our next steps, we're going to spend the next few months, so over the course of the summer and likely into the fall, the completion of our data analysis. We hope to engage stakeholders, and this is the last step of the Oxiana-O'Malley framework. So we'll be reaching out to our researcher colleagues as well as other stakeholders. And then we will then engage with the other part of the grant, which is in collaboration with CASN to develop some tangible nursing informatic related tools and some resources that faculty can access across the country. So I think that's it from me. Thank you very much for your time and attention. I guess I will open it up for questions. Thanks again.
Thank you very much, Dr. Chu. Excellent presentation.
Thank you.
So we have some time for the Q&A session. So at this time, just take a few minutes and either enter your questions in the chat or go ahead and raise your hand. Both Dawn and I can monitor the chat as well as the hand raising.
Charlene, if you'd stop sharing, then we can see the screen and we'll see the tiles. Great, thanks.
Sure.
Maybe I can just start with a question just to get it going. So Dr. Chu, can you talk a little bit about how these recommendations that you came to in relation to the scoping review, how does it relate to your experience relative to AI technology in nursing?
Thanks, Laurie, for the question. I think the recommendations that we've worked on thus far, Dawn, feel free to jump in. I also feel like this is like a broader CASN question too. I think the recommendations that we've come up with thus far are much needed. I think they get us to a place where nurses are becoming players within the field of digital health, not only just seen as passive users of technologies, and we're really broadening the scope and recognizing the importance of nursing knowledge within digital spaces and within the designs of technology as well. So I think that there is a lot that we've covered a lot of ground, and I do think that it is relevant to our students in general. When I teach at the master's level, certainly there's a huge appetite for learning more about this, and often my students have said that that they're not getting as much opportunities to learn about nursing informatics as they would like. So I think this is a really strong initial step.
For sure. Thank you. I see Sally has her question up, so we'll take that first and then address the questions that are in the chat. Go ahead, Sally.
First of all, Charlene, congratulations to you and your team. Quite a lot of work to summarize and get those ideas filtered out to some to me, very important new enhancements to the competencies. My question is with some of the recommendations, I think they're all excellent, but when you're thinking of exposing or providing students with the experience to learn and enhance and grow skills in nursing informatics in the clinical side of the house, particularly when we're looking at undergraduate students. I just personally have a caution, unless it's greatly changed now. Sometimes in organizations, they label people as they're the informatics, the nursing specialists. And in fact, sometimes those individuals, although they're keen, have no leadership or guidance on what types of things are important as they move forward with the adoption and leveraging of their new technical tools. So it just likens me to some research that I'm hoping to finish up shortly on looking at the whole data, information, knowledge, wisdom framework that I think needs to be, if I was being asked to be more front and center to help nurses focus, no matter what role, if they're, in on the front line or in any role across the system in which they participate.
Thank you so much, Sally. And thank you for your work. I've read your work over the years, so thank you. Yeah, with respect to the undergraduate students and the clinical practice side of things, I think I think some of the comments that were made around that and what we've seen in the literature were around really students starting clinical placement and not having access to being able to chart, not being able to give medications, not being able to partake in using technologies the way that nurses on the floor are doing, and then they depend on their preceptor to do the charting, to give out the medication. And so that's, I think, really what was coming out loud and clear through the literature, and I validate your concerns completely around potentially being elevated into positions of implementers when perhaps they've yet to receive some of that more hands-on training. Yeah.
Thank you.
Thank you. And I look forward to reading your work as well. Thank you.
Thank you for that. So there's a question in the chat here. I see Pascal has a question, which in the chat is worded as how as nursing instructor are covering AI and interacting with this technology when teaching. Pascal, did you want to clarify what you're asking there?
Yes, good morning, everyone. Thank you so much. So because AI is such a buzz right now and competencies of nursing informatics, how do you make that link as us as nursing instructor dealing with AI? There's positive side, there's negative side. Do we use it and how do we use it and how do we make it in a way appealing and interesting, but using the I would say the most interesting part of it instead of using the part that has been said in a lot of groups I've been reading mixed reviews about AI. So some people are saying it just takes off the spirit of people writing and be able to be more in depth in the way that they're looking at the world around them and so on. Some people are saying, well, it is a way to just start.
Did you? Just Lauren, not Ian?
Yeah. So I was wondering, how do you see AI? What's your perspective? And do we need to have specific competencies linked to nursing informatics? How do you make that link and that bridge?
Thank you, Pascal, for your questions. I think you asked several questions in there. I guess I'll try to touch on some of them. So, I mean, AI is all around us. And from my experience talking to nursing students, both at the undergraduate level and graduate level, nurses are really interested in AI. They are incredibly fascinated with AI, and they know that it dictates everything they see in their feed, everything they learn, everything they hear. I think they know that. And they also know that that is the same ecosystem that their patients are receiving care in, are receiving help in, are learning from too. So I don't think that making AI interesting is a problem. Like, I think that they're inherently really interested in AI. The problems that I see around teaching AI is this black box phenomenon, in that people who are designing AI themselves don't quite know even what's going on either. And there's examples of this more recently with, image generation from Google, for example, right? So I think when it comes to teaching AI, I think I'm not exactly sure how to navigate this space yet, and I'm just speaking very truthfully, is around how we can best use these tools in a thoughtful way within clinical practice that helps support building clinical nursing judgment. And I think when I speak to some of my colleagues, they're a big concern from frontline nursing staff is around this dependency on the output of some of these clinical decision support systems without any verification or double checking or accuracy checking. And I think that, and that is one of the competencies or one of the indicators that we've now put into the CASN framework. So I think and it's here to stay, right? AI is here to stay. And I think we can start off with building in with baby steps in explaining the ways that it has been implemented so far, and how it can interface with healthcare professionals. But there's so many different facets in how you can tackle that. We know from even the most advanced AI even today is not implemented into healthcare for a variety of different reasons. And so a lot of quote unquote AI is like basic regression that is being implemented. And there's also issues around evaluation, deployment, equity. There's so many different issues and avenues that you can take with this. So I think we do need to start off small, but we first of all need to put it out there and say that it is important for nurses to be aware of this. It is important for nurses to be in the field when it comes to AI. There's a really beautiful article that came out of McGill by Maggie Latuga and others, talking about healthcare AI and the revised Quebec framework for nursing education. So I'd highly recommend that read. That was an excellent paper. I hope I answered your questions. That's such a big topic. I feel like we need another hour to talk about that.
Thank you so much. I appreciate the answer. When I hear you, it reminds me what we do when Wikipedia came out. We would say in class to our students, well, when you look at Wikipedia, don't take what it says there. Look at the references and start by looking at the reference and go see those references if they are accurate, and then start from there. It's a nice springboard to start a research or start looking at your topic. So it is quite similar to what you're saying, as a way of starting something and looking further and just making sure it's accurate and it is evidence-based, basically. So I appreciate that. And thank you so much. As you said, AI is around us. As you do your emails on Microsoft right now, they suggest you a way to already start your email or what kind of answers. So, I mean, some people even are not aware that that's AI. So thank you.
Yep. Thank you, Pascal.
Thank you for the question and the answer. I'll just take the hand that's up right now. I'm hoping to pronounce your name correctly, but Manal, go ahead.
Right, thank you. So my name is Manal Karib. I'm an associate professor in the Faculty of Nursing, University of Alberta. And Dr. Shuo and I and the team, we've been working on, like, as part of the Digital Health Advisory Group, to work on integrating all of those updates and kind of really take them to the next level. I wanted to share, first, I want to say that I'm so pleased that I am seeing so many educators on the call. So this is one way, Pascal, like this whole thing starts, like by engaging the educators, by engaging the clinicians to be part of the conversation. Because no matter what we do, we cannot fix this issue. Like we can participate in thinking together. How can we navigate this complexity? Because it's facing all professions. I think in Canada, we have been very fortunate to have the leadership to support this work and to support educators in staying current in their practice and their pedagogy and addressing emerging trends like AI and generative AI. So there's so much to learn for everyone, and this is like the beginning of addressing this major concern. So I invite you to join the digital health advisory group with CASN, because this is another forum where we can continue this conversation. There will be many other webinars and activities for you to also focus on these applications in more depth. The third thing I wanted to mention is that these updates are excellent starting point, but those should not be taken for granted because the field is evolving so fast. So those competencies will be kind of a guidepost, but we hope also the educators continue thinking about them and continue kind of bringing about what are some of the challenges in terms of implementing them. How can we maybe take them to the next level? How can we maybe also include graduate level students in thinking about all of those issues? So it's kind of an evolving field, and the whole process will depend on how do we embrace it. There is no need to fear what is going on. It's part of the change process, and we need to just continue taking this one step at a time and engage more educators into this process. So I look forward to seeing many of you join our small group, because we need to take this really to the next level. Thank you.
Thank you for that. Charlene, did you have any comments associated with that?
No, Manal's on the advisory group, and I've learned an immense amount from her. I'm very, very fortunate and feel very blessed to have worked alongside her. So join our team, everyone, if you're interested in being part of the movement.
Thank you for that. Okay, so we have about 12-ish minutes left. Next, I'll take a question from Dominic in the chat. Since there's a lot of buzz and concern about generative AI in nursing education and practice, can you share what came up in your research about generative AI tools and technology? Thank you.
Great question. This is just like top of mind for all educators, I feel like. And if you haven't used ChatGPT yourself, or if you haven't used Copilot yourself, I highly recommend to just, as an experiment, as an exercise, take one of your prompts from your class and enter it into ChatGPT and just see the output. A quick exercise. It'll take you less than 2 minutes to do it, but I would highly recommend everyone do that, and then you can get a sense of the capability of this technology, and it will just continue to get better and better and more accurate. So in the literature, what we saw, not specifically to nursing in general, although some of the literature when it came to nursing education was around ethical use of the ChatGPT tools, whether or not the output of the ChatGPT tools were accurate and informative. There is literature out there more generally around the use of chatbots and ChatGPT with medical education and the rapport between clinician and patient. I think the paper is by Ayers, A-Y-E-R-S, and they looked at physician interactions with fake patients, and then they had other third parties basically read the transcripts and decide whether or not ChatGPT's conversation with this patient was more empathetic than the actual doctor's conversation with the patient. And out of 26 different indicators, 24 of them ranked ChatGPT to be more empathetic than the actual doctor itself. So generative AI is a new tool that is really, really interesting. It will continue to evolve. From what I'm seeing also more generally when it comes to generative AI in education is you can look at Ethan Mollosk's work. He's from Vanderbilt, but he essentially puts it into the spectrum where you have on one side of the spectrum your student that, you know, used the student before ChatGPT, where you had an assignment, you would do all the work yourself, all of your ideas, your structure, your wording, everything was done, you know, led by the student. And then on the other side of the spectrum is the student that might take the prompt, put it into ChatGPT, and literally copy and paste it and use that as their assignment. So you kind of have this spectrum where you have two sides, and in between there's lots of shades of gray. And we need to be aware of that as educators. A student can have their initial idea and it can be refined using ChatGPT. They can have their essay and it can be reformatted or structured in a way that flows more logically using ChatGPT. You know, we can have, and then it gets more into they need ChatGPT to help them generate ideas, for example, or to help connect different theories to different clinical practices, whatever the case may be. And then there's more synthesis, you know, in that realm. So again, there's a wide spectrum of uses. I think us as educators need to be aware of that. And I think students also need to be aware of that. Certainly in academic publishing, you need to be transparent in how you're using ChatGPT. There's a lot of legal issues that are happening right now with ChatGPT and the output of ChatGPT, and people not being aware that if they copy and paste from ChatGPT, they could inadvertently be plagiarizing, you know, the New York Times or any kind of, publication that has open access, because ChatGPT will scan the internet and then use that information to answer the questions, and it could be producing basically word for word. So there is some like legal ongoing issues, and so students need to be aware of all of those things, as do educators.
Thank you, Dr. Chu. So now Dawn is going to introduce the question posed in the chat by Tracy.
Oh.
So I see Tracy has a comment and a question. I just go with the comment first. So she was just mentioning that NYU had an excellent day on generative AI for teaching and learning, multidisciplinary, but folk-directed educators in AI use, as well as student perspective. So that was a great comment, Tracy. Now your question is about operational organizations who are hiring new graduates. So CASN has a process to revise competencies. So Charlene was mentioning some of it. There's an advisor group, there's scoping review, and environmental scan. And then the group worked on them. So currently, CASN is working on, and so then in the next step in this whole process, the validation survey that's sent out quite widely. So currently we're preparing that. So that's where, Tracy, I'll remember your name. And we can put it out to some of the organizations who are hiring folks, so that you will have a look at what we've come up with and offer your comments. So that's what we can do. Does that sound okay, Tracy? Just one more quick thing I noticed, Pascal, Charlene, he is asking if you could give the reference to the McGill University, some reference to McGill University, Charlene.
Yep, absolutely. Put that in right now.
Thank you. I see a hand up by Cynthia. Go ahead.
You're on mute. You're on mute.
I think, yes, just before we finish, I wanted, well, first of all, thank you so much, Charlene. This is really interesting, really excellent. And what I love to see was the list of CASN being second in influencing or involvement in the field. But I also wanted to take the opportunity to thank the Digital Health Advisory Group. Amazing work, great commitment. Excellent. So thank you all.
Okay, any other questions?
Thank you so much for the reference. We appreciate it. Thanks.
No problem. Thank you.
So Dr. Chu, I don't see any other questions, and I don't see anybody ravenously trying to step in with their hand to ask a question. So at this time, I just wanted to thank you again for the presentation, Dr. Chu, and thank you to all who attended this webinar. Please note that the link to the recording of this session will be made available to all registrants. Please feel free to share this link widely and proudly with your networks. And thank you to everyone joining us today. CASN certainly hopes you'll join us for the next Lunch and Learn on May 23rd, when Dr. Richard Booth from Western University will present the evolving intersections of technology and nursing, preparing for an AI augmented future. So thank you so much and enjoy the rest of your day.